far. In the Mai Mahiu, Naivasha, after a seasonal dam burst, it bangs in an old Kijabe area, sweeping away tens of homes and victims living downstream last night. There are fears that the numbers could rise, with tens of people uncounted for following the 4 a.m. incident that caught victims asleep. The rescue operation is still underway, with more than 100 people already rescued and treated at Mai Mahiu Health Center, and 32 cases referred to Naivasha Sub-Hospital for specialized treatment. Following the incident, a section of Naivasha, Mai Mahiu and Mai Mahiu were closed as authorities moved in to clear the mud and logs that had been washed away by gushing waters.
Naivasha constituency, Nakuru County. Operations have been going on. Trees are down. There are bodies. They are still looking for more bodies, I hear. It's just sad. It is a sad moment for us here.
Ni kwamba all our stakeholders in the private sector watusaidie na the ambulances. So far wenye wametupatia tunashukuru. The Red Cross tunawashukuru sana, lakini waendelee pia kututumia. Tunahitaji pia msaada wa kidharura. We have so many people affected. Wengine hatujui mahali wako, wengine hospitali zimejaa. Kwa hivyo we are calling upon all our doctors, all our specialists kindly to put the strike aside and come and assist us. The situation is a horror. It's like a horror movie you are seeing.
Yakakuja na nguvu nyingi sana, na maji yameleta madhara ambayo hayajaonekana Mai Mahiu tangu tuzaliwe, sababu imebeba watu, imebeba manyumba, imezoba mpaka magari. Sasa bado watu wanazidi kutoa maiti, hadi wa saa hii maiti inaendelea kutolewa. Haijulikani idadi ni ngapi ambayo watu ambao wamekufa.
Right, and we will be linking up with our reporters later on, including Ken Gashohe, who will be telling us what really happened and painting us to a picture of how the rescue operation is coming by. Meanwhile, I'm now joined by Alex Ayub from the Red Cross, who is live with us here in studio. Alex, please paint for us a picture of what kind of a disaster you are dealing with at the moment.
Yeah, thank you, Grace. Currently, we have a flood situation in the country, and the situation is quite dire, with very unimaginable incidences happening. Of course, initially, the conversation was about just normal floods and rivers probably going beyond what you call above normal levels. But we have seen a situation whereby, like the unfortunate incident waking up to the morning of today in Mai Mahiu, specifically in the Kamuchiri area, where we had the old Kijabe Dam breaking its banks and being able to unfortunately catch a lot of people off guard in the wee hours of the night. And so we have had quite a couple of people who have been injured. A couple of them have also lost their lives. We are talking about over 40 people who have already been confirmed dead, and hundreds of others who are still being supported with various situations. So the current urgent work of Kenya Red Cross, we are currently on the ground, and we are having the search and rescue efforts going on. We have our volunteers, our staff, the teams of the trained people who are on the ground supporting with also evacuations, especially from the scene to the hospital, the Mai Mahiu health facility that is there. And there are also other needs that are coming up. For instance, we have situations of people who do not have food. Some of them have their houses houses having been marooned by the waters, and so it's a very dire situation. And we still have live efforts, active operations currently going on in Mai Mahiu. Yeah.
So when you talk about Mai Mahiu, you also have other counties that, of course, have been affected by the rains. We've had cases in Tana River, Machakos, Makueni, Kilifi, Garissa. The biggest question, rather, maybe is as Red Cross, as an organization, are you capacitated enough? Because, for example, like the Mai Mahiu incident this morning, bodies were laying over before rescue came up. So what is the issue?
There's been a very high level of preparations and preparedness of the various agencies in this country, including the Kenya Red Cross and the government. And part of what has been happening is that you realize that the nature of the disaster that you're dealing with currently is one that has a very dire consequence, in the effect that it also tends to destroy certain key infrastructural spaces, for example, roads. And this also really makes it very difficult difficult for the rescue operations to go on. We also have situations whereby, for instance, when a dam breaks its banks and the walls, I think it's a very sudden situation that many, no matter how well people had prepositioned, then it actually requires that then certain measures are put in place to ensure that people are able to be mobilized in time. And so we are well prepared, but then, of course, our capacities continue to be stretched as we're speaking, because as you mentioned, several counties, you're talking about over 33 counties that have been affected across the country, with over 19,000 households are being affected. And so this is really stretching the capacity of the Kenya Red Cross. And we're really calling upon the other stakeholders, the other agencies, the well-wishers to come in and either support these efforts through the Kenya Red Cross and also support in reinforcing the resources that we have currently. Yeah.
Now we are staring at a dire humanitarian situation in the coming days, having dealt with such crises before. What advice can you give to Kenyans now that the rains are even heavier and floods are still there?
The first thing is a very straightforward thing. We have areas that have been clearly marked as potential high-risk areas where we could be experiencing floods because of either their closeness to riverbanks, their proneness to flooding based on the infrastructure, topography of the areas, or even general drainage in certain spaces. And so one of the things that we are really asking Kenyans is to move to areas where either there are higher grounds or on spaces that have been clearly marked as higher grounds that could be safer. And we are also really asking other agencies to support in this, because it's not enough to tell Kenyans to just move, but then where are they going to? So we are working with the government to ensure then that at all levels, the national and county governments, to ensure that even for these particular areas, then we have enough prepositioning of items to ensure that there is temporary shelter for these particular individuals. But the general advice is be safe. I mean, some of the situations that we are having can be avoided, could be avoided, should be avoided. We have Kenyans taking risks, very high risks, and I don't think the risks some of us are taking are worth our lives. But then at the same time, we are saying then that we will still continue being there. Kenya Red Cross is still open. We are ready to support, but then we also need to work closely with very close coordination with various agencies.
Now, Alex, perhaps if you get yourself in such a situation, what should you do to survive in floods?
Well, the one thing that is obvious is the assumption that people have probably some aqua rescue, some swimming skills that is needed. But the nature of the disaster that we are experiencing is that the water flow is at a very high speed, and that also makes it very difficult for even pro swimmers, aquatic people to be able to support and even to be able to be safe. So the safest thing right now we are asking is just try as much as possible, be on the lookout on the information that is coming out from the Kenya Meteorological Department, from the Kenya Red Cross, on the media, from the government. We just be on the lookout of this information and try and not be in those spaces. And in the event that happens and you still have the opportunity to reach out, Kenya Red Cross has a toll-free number, 1199, that is 1199, and this number is 24/7. So call and someone will be able to come, someone will be able to rescue and be able to coordinate with you to keep you safer. Yeah.
So finally, Red Cross works hand in hand with the national government. Perhaps what should be improved in prevention of such cases in the future so that we can have timely response to try and save lives?
Currently, we have what we call the early warning, early action system that I know Kenya Red Cross has been really working with, and I know the likes of the National Disaster Operations Center has also been working in this particular space. And the one thing that we really need to improve on, and this is generally as a country, not necessarily particular agencies, is making use of this information. The communication on early warning that yes, we might be experiencing flood has been there for quite some time in the media, but then little action has been taken either by Kenyans themselves, but also sometimes by the various agencies that are responsible. So the one thing to say is that making use of data and information that is coming to warn us or even trying to keep us safe from the Kenya Meteorological Department, Kenya Red Cross, the government. And so when we say early warning, it's supposed to help us in order to take early action to keep us safe in the level of preparedness. So it's just an improvement in the preparedness and more so in use of information and also prepositioning of items for support.
All right. Thank you, Alex, there for sparing time with us. That is Alex Ayub from the Kenya Red Cross asking you to please keep safe, follow what the Met Department is saying, do not cross when the waters are high, please do not cross, stay safe, remember your family needs you, and also the nation as well also needs you. And from that, we're now going to take a very short commercial